So, happy Thanksgiving week, Decatur. We have much to be grateful for and much to discuss today. Let's start with some of the important information. One, I think we're realizing that COVID-19 is real, and there are cases in our community. Today, we have already learned that 73 have been reported overnight. We've added over 230 cases from Friday to Sunday alone. In the last 14 days, Morgan County has added over 1,000 COVID-19 cases. We've had 5,620 cases throughout the entire pandemic. And just pause a second to think about that. Whenever I look at the Bama Tracker chart and look at other counties, Morgan County per capita is leading the state in positive cases. And that's not something that as a mayor that I'm very proud of. We like to lead in other areas. So there's a COVID event risk assessment planning tool from Georgia Tech, and there's a current risk level of 60% for gatherings of 25 people in Morgan County, given a 5-to-1 ascertainment bias. So let's put that in real simple terms. If you're in a group of 25, there's a chance that one of those 25, 62% chance that one of those 25 is going to be positive. Please give consideration to that when you make your plans, and make sure that you are distancing and doing all the things that's been asked by the guidelines. We must do our part to avoid another shelter in place, because we know it would have a significant impact on our local businesses, their employees, our schools, and our neighbors. Right now, with our schools being in a virtual situation, that means that there's a lot of parents that are at home, and in many cases they aren't drawing a check, and that's very concerning. Today we're fortunate to have three guests with us. We have Judy Smith, the Northern District Administrator for the Alabama Department of Public Health. Judy, it's good to have you back with us again. We have Kelly Powers, who's off camera right now. Kelly will join us with President of Decatur Morgan Hospital. And then all are my friend, but my friend John Seymour with Decatur Morgan Chamber of Commerce. John, good to have you with us.
Thank you, Mayor.
Yes, sir. So currently, I mentioned the number of, we have 5,620 confirmed cases, which is a 10% weekly increase. If you're still wondering about your Thanksgiving plans, you're not alone. We've uploaded a full list of COVID-19 holiday safety tips to our homepage on the city website, which has a new web address at cityofdecatur.al.com. Now, this year has been hard for each and every one of us. Be sure to check on your friends, our young folks, our elderly. If you know someone that's having some concerns as it relates to mental illness, emotional distress, suicide, please contact the National Suicide Prevention Lifeline. Trained crisis workers are available to talk 24 hours a day, 7 days a week. Here's the number, 800-273-8255. Say it again, 800-273-8255. As always, if the situation is potentially life-threatening, call 911. And we talk about that because last week, whenever Kelly visited with us, she talked about seeing an increase in this type of concern, and we want to make sure that we're helping with that. This is especially the season for all of us to be kind to one another. Just check up and make sure that kindness is at the forefront. Generosity of the spirit is what the holiday season is all about. Let's reconnect to that cause and do our best to help our community. Thank you to our healthcare workers, our first responders who work around the clock, including holidays, to keep us well and safe. So with that, John, why don't you, if you will, give us an update on our business community.
I sure will. Thank you, Mayor. Appreciate the opportunity to be here and talk to the citizens of Decatur and Morgan County. We have a lot of businesses, retail and restaurants, that this is their prime time of the year. Between now, this week, and Christmas and after Christmas sales, they make their year. And it's critical that we shop local. I can't say that enough. that we shop local, but we do it in a safe manner, and we do that by ordering on phone, by curbside pickup, by takeout food, by all the ways we've talked about for the last several months to do it, shop locally safe. You can order online with your local merchants just as well as you can with an out-of-town vendor. So please, please support our local businesses. You know, when we get through with all this, you're going to go back to those local people and ask them for contributions to your church and contributions to your yearbooks and contributions to their youth sports programs and all those kind of things. Those are the kind of people you're going to count on, and they've got to count on you now. So please, please, this is an opportunity to pay them back. There's a couple of things we're doing at the Chamber, and there's a couple of things statewide I want to mention that'll help us be able to do that in a safe way. Governor Ivey has announced a new grant program, $200 million grant program. It's called Revive Plus. It's for small businesses with under 50 employees. It applies to small businesses, nonprofit organizations, and faith-based organizations, and it starts today at noon and goes through December the 4th. So those grants are done in increments of $20,000, which would be very helpful to a small business. And for small businesses that are interested in that, they can go on the COVID Relief Fund website and get all the information they want and the application to apply for that. The other thing we're doing locally, the Chamber is doing a program where we are going to try to support small businesses and retailers. We're going to have a gift box on the back porch of the Chamber. If you'll bring receipts from local businesses from $20 up, put your name and address and contact information on the back, put it in that box. We're going to draw for 10 $100 gift cards to be used at local merchants in Decatur, and that starts on the 27th and goes through December the 14th, and we'll draw on the 15th of those 10 gift cards. So take your receipts of $20 with a local merchant, put your information on the back of the receipt, put it in the box, and then we'll have the drawing on the 15th. That'll help us, again, to support and bring attention to small businesses in our community. The other thing I want to talk about is a mask, face mask that's been developed by Ascend that is biotechnical. It's a very safe mask. It can be washed. It's like the other masks. It's very thin, very easy to breathe through, but it can be washed 10 times and reused. And our local business, Ascend, has provided those. They've provided the Chamber with 100 boxes of 25 masks each. So the first 100 businesses, small businesses in our community that contact the Chamber will give them a box of these for their employees to use in their businesses. So we're doing some things at the state level and the local level to support our small businesses and our retailers. So please, please think of them when you get ready to do your shopping and your online food ordering and your Thanksgiving dinner. Please think about our local restaurants and our local businesses. Mayor, I appreciate the opportunity to be here and talk about that. Thank you.
John, thank you. Thank you for your leadership and what you do, the Chamber does for our business community. I know today we're focused on COVID, but our Chamber does so much, workforce development, residential growth, and you're very effective, and it's a team sport in that everybody pitches in, right?
Well, I think we're going to be in good shape when we come out the other side with our economy, but we got to continue with this busy time of the year for our retailers and restaurants. It's critical that we help them keep their doors open.
Good. Thank you. I hope you have a good Thanksgiving.
Thank you. You too.
Mind making room for Miss Kelly to jump in and join us? I want to save Judy for last because she's always got a lot to share with us. Kelly, how are you?
I'm good. How are you?
Fine, thank you.
Thank you for having me.
Yeah, good to have you.
You want me to give my update?
Yes, ma'am.
Well, we're continuing to see increases. As of a few minutes ago when I left the hospital, we have 50 inpatients, which is an all-time high. I think I shared with y'all last week, we were at an all-time high, but this is getting to a critical stage. We had 8 PUIs, so that means I've got 58 patients of the 150 that I have in-house today that are COVID-related. 6 in ICU and 1 on the vent. While that seems low, what happens with COVID is some of the patients become positive, and we get them as inpatients and we treat them, and then they, some do not respond well. So I would say next week, we'll probably double what we have in the ICU because of all the inpatients. So it does take a little while for some of the patients to, the disease to take over their current state. Employees, 20 that are positive, and I've got 36 self-quarantine. That doesn't include some that are self-monitoring. A little bit different in the fact you self-monitor if you think you've had an exposure, but those people are still coming to work because we don't know that they had an exposure or not. But again, that's a total of 36 employees that are out right now. As of this morning, I have enough beds for ortho surgery schedule and working on general when I left. But that is our fear going forward, and I talked about that before, is not having enough beds for all of our elective surgery. So we are trying to work through that. We are opening the COVID unit today at Parkway. We're starting out with 15 beds. Before I left, they had 4 patients, and they were going up to 6. Trying to make sure staff, everybody knows the computer system and everything that's involved with that to get it up to 15. So I feel probably within the next day or two it'll be at 15. And then the other thing I wanted to mention is we are very low on reagent for our testing kits. So we have Abbott and we have a Cepheid machine, and we are low on those. So we're working to try to get more reagent from Huntsville or from the vendors on that, but that is another concern I'm trying to work through today.
So not to put you on the spot, obviously this is very concerning. Those that question, boy, the media is just exaggerating COVID, and hospital bed counts don't deny.
They don't lie.
They
don't lie, yeah.
Yeah, those are real things. Whenever you talk about your staff, and I've been in the hospital for some tests and things recently, how everyone is so protected on a staff level. How do they end up getting COVID?
It's usually it's out in the community. It's not necessarily at work.
Okay.
Yeah, almost, I would say probably 90% of ours is positives where someone in their home, has it, or they've come in contact with someone out in the community that is positive. It's not at work.
Okay.
So,
and you have a lot of employees.
We do.
Yeah.
We do have a lot of employees.
Yeah. Thankfully, whenever they come into the workplace, they're all protected and they're not in a position to pass it on to a coworker. Well,
Yes.
that's good. Well, Kelly, thank you for that. But did you have something else you wanted
Well, I
to
just wanted to say, I think the main thing, and I know Judy tries to always talk about this, is the mask. My son said, "Mom, these masks, I'm not sure they work." And I said, what does it matter? Just put the mask on and wear it. I mean, at the end of the day, he reads all these blogs and all these things out there like a lot of the viewers probably do. I mean, it's a simple thing to do. And again, if you don't have a mask, we'll figure out how to get you a mask. But not only to protect yourself, but to protect the other people in our community. And as the mayor said, it's continuing to rise. And I tell you, I am worried about Thanksgiving and, after that, and how we will keep up with the demand if we continue to increase like this. So please just wear your mask and social distance.
Thank you, Kelly.
Thank you.
Miss Judy, I know you're tired.
It's okay. But Mayor, I do want to reiterate what you said. Happy Thanksgiving. And we are truly a blessed city. We're a blessed state. We're a blessed nation. I do want to mention that I was one of your nurses, one of your Decatur nurses that went to 9/11, 19 years ago. And I remember when we first came back, one of the biggest things that we had everywhere was God bless America, God bless America, God bless America. And that became a huge thing. And folks, God has blessed America. We are such a fortunate nation. We have so much capability, so much intelligence, so much opportunity. Why in the world are we the nation that is so behind other nations? Why in the world are we the nation that keeps seeing our numbers grow? Because we simply just don't want to hear the rules. We don't want to follow the rules. So, I think Kelly and I and the mayor and Mr. John would all like to have nothing but really exciting things to say, really good things to say. But unfortunately, there are, it's just really a very, very stressful time, particularly for those folks in the medical fields and for those folks out there. They're expecting us in the medical fields to do what you need us to do. Some good news, since we do tend to give a lot of tough news, some good news, some of the vaccine will probably be here by the middle of December. Now, as you all know from listening to the news, it will probably go to first responders first, and certainly to our hospital folks and to other first responders like our EMS folks who go out and get folks and take them to the hospital. Right now, we are working massively on plans. We will be doing that the entire Thanksgiving holiday so that we'll be ready when it gets here. There will be an hierarchy in terms of recommendations of who should get that vaccine first. Some of you may be happy that you're not the one that's going to get it first, so you just want to see how it goes. But there is hope. There really is hope. Now the downside to that is that even if we have the vaccine by the middle of December, like all vaccines, it's going to take about 2 weeks to build up immunity, which means that it'll probably be the 1st of January before folks really have immunity. And I want to tell you, I want to back up and tell you a little bit about what has gone on this month that, as Kelly said, scares us to death, absolutely scares us to death. 1 month ago, we had 195,000 cases, a little over almost 196,000 cases in this state. Today, we have 234,080. That is an increase of almost 60,000 cases in 1 month. 1 month. In Morgan County, 1 month ago, we had 3,968 cases. Today, we have 6,182 cases. That is, in this county, 2,214 cases. That's been an increase. In the state, we've had 654 additional deaths in this month. In Morgan County, we've had 14 additional deaths. Every one of those are folks that really wanted to spend time with their families for the holidays, we say we're all in it together, but are we? I have to be honest, sometimes I think folks like the mayor and Kelly and myself, we kind of feel like Jeremiah, the weeping prophet, who continued to try to tell the people how things are and what we needed to do. But at the same time, a lot of folks still think we're Chicken Little. We're just screaming that the sky is falling. Well, folks, the sky is falling at Decatur Morgan. The sky is falling. I will tell you that I actually had a conversation with somebody this weekend that had a non-COVID, basically emergency kind of situation, but it was a hospital situation. That person had to be transferred to a hospital or had to be admitted to a hospital in another county because, quite honestly, there wasn't room for that. There was so much emergency stuff going on, there just wasn't room. This is our county. This is our healthcare system. This is our people. We've got to do what we need to do to take care of them. We want you to have a wonderful Thanksgiving. We truly do. We know it's been a tough year. We want you to be able to see your folks, whether it's in person or whether it's via Zoom. We really want you to do that, but at the same time, please follow the rules. If you're going on an airplane, if you're going in a car, take all your pills with you, take your vitamins, take your other stuff, but please take your mask, your social distancing. How do you social distance in a car? You sit in the back seat and tell your husband how to drive and sanitizing. You do what you have to do. When you're in, and by the way, all the Uncle Joes that are out there that are not going to get to come because I told him last week he could not come to Thanksgiving dinner, I think they're all expecting me to deliver dinner to them or else planning to show up at my house. Please don't come, Uncle Joe. I'm still going to put you out back even if it's raining. But, there are other rooms in the house. This is a great time to get out those little extra tables and move folks around. And I know what the mayor said a minute ago about the size of the group and the potential to be exposed. Listen, it doesn't take but one person. The size can be 3 people. It doesn't take but one person. And if that person, and we're seeing this all the time, just like Kelly said earlier, the calls that we are getting and we're going to get next week, the end of next week, we're all getting ready, dusting off our phones and this kind of stuff is going to be, we went to the family gathering and we tried to stay out back, but it just didn't work out, and now somebody is positive and so we're all at home. And as Kelly also said, it's not just that person being isolated. It's the other people being quarantined. We have a lot of situations in hospitals and other businesses where people can't go to work for 14 days because they have to stay with a child or whatever. That is devastating in addition to the other things. That is devastating to a business. It is devastating to the healthcare system. It's devastating as a whole. Please have a wonderful, wonderful Thanksgiving. Please stay safe. Follow the rules, and we'll be a heck of a lot better off. Just please do what we need to do. And I'm going to follow up with what Kelly's son said and say, Mr. John was telling me earlier, he was talking to a business person that is in construction, and they were talking about putting on their hard hats and this kind of stuff. When you put on the hard hat at the construction site, by the way, a lot of these hard hats go on hard heads, but anyway, when you put on the hard hat at the business site, you're not really expecting something to fall on you, but it's there in case it does. When you put on the mask, you hope you're not going to be exposed to COVID, but it's there if you are exposed. And I will tell you, evidence has shown they do work. They are not perfect, neither is the umbrella, and I'll stay off my other public health examples, but they're not perfect, but they do work. Do what you need to do to be safe. When you're packing your pills, take this pill with you. It may be a little bit bitter, but it's a heck of a lot better than ended up in Kelly's hospital right after Thanksgiving. Thank you, Mayor.
Thank you, Judy, as always. So we'll take questions.
I'll start with Kelly. You said that the situation that you're currently in and your staff is critical. How critical is it?
Well, I think the main thing is trying to figure out placement for some of these patients, as Judy mentioned, and it's not just Morgan County. I mean, Huntsville has a lot. I was on the phone earlier this morning with DCH. I mean, they have a lot. Everybody has a lot of patients right now in Alabama. So being able to transfer patients, I think, is something we are going to see as a problem going forward. But having enough staff, they're all tired. So I think just, we're going to keep taking care of patients as long as we can. So, but the main thing I just want to get out to the community is, at some point, is there enough ventilators? Is there enough ICU beds? Those are the things that keep me up at night as far as it being critical.
If you end up having to stop elective procedures, the ripple effects associated with that and how it impacts, therapy, physical therapy,
right.
so that kind of
Right.
impacts them. It has impact on our pharmacies.
does.
Tremendous.
My physicians, it impacts them a lot too, so.
Back in July, the highest was 34. At that point, we were like, wow, this is really high. You're kind of close to doubling that.
Right.
Did you, I talked to you Friday, it was a new high.
Right.
3 days over the weekend, you're at another high. This isn't going in the right direction, I guess. Can you explain to people the strain, one, that it puts on the hospital, and really the risk of doing something so easy as putting a mask on could in turn decrease those numbers instead of going in the wrong direction?
Well, and what it does is it really strains the healthcare workers, as we talked about earlier, the fact that they're already tired. We're paying people, we are offering bonuses for people to work, and they look at you and say, there's not enough money. So at what point do we not have enough healthcare workers to take care of the patients? The physicians are tired as well. And then back in July, and even a few weeks ago, we had a high in our ICU, and that was what scared me the most. Right now, my ICU, I've got, I think, 1 bed this morning, but I only have 6 COVID patients in there. So if I see an increase in that, that's where it really is going to be hard for us, is we'll have to create some makeshift ICUs. We'll have to go to Alabama Department of Public Health and get some EMA help to figure out where we can put those patients and who we can bring in to help with that. So that's what I guess I worry about most.
With the new unit opening today, I guess what are you most looking forward to? Not that this is the time forward to things, but there are some positives with the new unit opening at Parkway.
There are a lot of positives. We have a lot of new staff over there. people that have been traveling that are back in our county working. The main thing I was looking forward to was giving them the patients and letting that be the only COVID patients in Parkway there. But now that we've had such a spike, I'm having to take a lot of beds at Decatur for that. So, but it is, new beds that we can add patients to. Thank goodness we planned that ahead of time to have those. We're also working on a plan right now to get up to 36 because I think we need that sooner than later. But it'll take us a while to get there. We need physicians, staff, and some capital equipment to get there, but we are working on a plan for that. But the positive is knowing that we have those beds and we can open them up eventually to do that.
When do you hope to get to 36? It took you guys, about a month and a half to hire for enough to open 15 beds. When are you hoping to get to 36 with, you and Judy and everyone else in the country saying that there's going to be an increase after Thanksgiving, after Christmas, and then mid-January?
Well, we had hoped to have it open by January because there's data that showed January was going to be a huge spike. So honestly, I don't know. I'd love to, as soon as we're working to post those positions, hiring the staff and the physicians is the main problem, so.
A lot of people have been asking about coming in contact with people who test positive. I know we've been over this, but if you come in contact with someone who's positive, talk to me about the protocol that should immediately follow after that.
Well, anybody that's actually has close contact with somebody that's positive needs to immediately go into quarantine themselves. And sadly enough, and it is proven to be necessary, it is 14 days from the last contact of that person. So, for example, if you're a mom at home, a nurse at home taking care of your child who's been at school who is now positive, you're probably going to be with that child their entire 10 days. Then your 14 days does not start until their 10th day, assuming that they're okay by that 10th day. That can be devastating to the hospital care system. That can be devastating to any care system. So, we are just such a society that wants treatment. We don't want prevention. We don't have to have a spike after Thanksgiving. If we did what we needed to do, if everybody would just do their part, we could be okay. It's proven that we could be okay. I forgot to tell you all, I wore my Thanksgiving shirt, and I have to play show and tell. But this is what I will be wearing for Thanksgiving, and everybody will stay away from me. Stay away. If you're not exposed to it, you're not going to get it. If you wear a mask, then you certainly are cutting down the potential to get there. So if we just each do our part, we can make things so much better. And Kelly, again, is absolutely correct. It is community spread. We even have that in our own offices. I went to the birthday party, I went to the wedding, I went to the whatever, and 2 weeks from now, it's going to be, I went to the Thanksgiving dinner, and maybe we didn't do what y'all asked us to do. So,
with coming in close contact with someone, obviously you're supposed to quarantine, but for people who want to go get tested, the day after they were exposed, you're probably going to get a negative test. So what's the recommended time frame to go get tested if you were exposed to someone that tested positive?
2 to 5 days is usually when people have an onset of symptoms, so probably a good rule of thumb is probably 3 days later, 3 to 4 days later. And I'll tell you, one of the things that we see the most is people get exposed on the weekend, Saturday and Sunday, so then what we've tried to do is make our testing clinics available, particularly on Tuesday and Wednesday, because that's when the largest, request is. Sometimes we'll talk people through it on the phone in terms of saying, maybe not just yet, or maybe get a rapid test, but then follow it up with a PCR.
You read my mind. In Mobile, they're doing know before you go testing. That's what they're calling these pop-up clinics. They're rapid tests for people who are traveling or going to places where, you're going to be at Thanksgiving with people who you do not live in the same household as. Is there anything like that in Morgan County or surrounding counties where people can go and get know before you go testing if you plan to travel this holiday?
Listen,
season?
rapid tests are available everywhere, but the problem with the rapid test, well, actually, the problem with any test is when you get it, you're testing, it's a time test. You're right then, when you got tested, it may be negative. Tomorrow, it may be positive. Now, there's also a higher degree of error in the rapid test, but it's still a good thing to do. I don't have any problem with that whatsoever. And if you, again, look on the dashboard, you will see that our colleges around the state have positive students right now. All these kids are fixing to go home. There's a lot of reasons to put that kid in the back room and don't see him till you send him back to college. Most parents are not going to do that. But, you're just going to have to be careful. And again, even when you're with your own family, as much distancing as you can, and quite honestly, as much masking as you can. And we know people are not going to sit in their homes and mask, but there's no reason you can't spread out.
Hey, Judy, you may not want to, I understand if you don't want to comment. Have any experience with the new app developed by UAB, GuideSafe?
That's going to be a wonderful app. It's going to be absolutely great if people use it, if they put it on their phone. And one of the things it's going to do is it's going to alert you to other people that if you get into a situation where there is somebody that is positive, that has a test on there. The problem is everything helps some, but everybody's not going to be on the app. It's a great app to have. There's actually another app that they're doing for the testing procedures, where people are notified their test results if they don't want to hang around on that app. So, they're both great. Listen, it's on the Alabama Department of Health website, how to get on that GuideSafe app. It is a wonderful thing to do, particularly if you're traveling or you're coming out of a school area and going to somewhere else, or you're going to be exposed to folks that were at school or folks that were traveling. So it's a great thing.
Good.
Please look into it.
So a little bit about the app for those that don't know. It's totally anonymous. It doesn't share who you are. It works just by Bluetooth and notifies you. It knows once someone is labeled as positive, it notifies you that you've been in contact with someone who is identified as being positive. So, look, very good visit this morning. Thank you to all of our guests, our chamber, our local hospital, our Department of Public Health.
Thank you, sir.
To the media for covering the event, for our team that makes this happen. And we hope that everyone will have a nice Thanksgiving. Speaking of, be sure to check out, visit our website and social media regarding solid waste collection during the Thanksgiving holiday. And our next press conference will be November the 30th at 10 a.m. and we'll see you then. Thank you.